So whenever we are trying to improve our performance, we're trying to get stronger, we're trying to increase our mobility, we're trying to rehab an injury, we're always testing and retesting position, because position and my capacity for position, for these ranges of motion, for these certain body shapes, like your squat, your deadlift, your overhead position, they provide a real-time analysis for how well is my body functioning. Do I have strength and power through that range of motion? Can I go through an anatomically full range of motion, yes or no? And I use the mobility work to get better at those shapes. One of these shapes is what's often called your pigeon stretch or your couch stretch position. So something that we're looking at with this shape, and I'm going to do this elevated. You'll probably want to start with this on the floor, but play around, you do what's best for you. And what I'm looking at is I want to have my leg up like this. This is really isolating my external rotation in my hip. So remember, like when I'm squatting, I create this external rotation through my hip that looks like my knees are spinning outwards, right? So I want to isolate that range of motion and get better at it. So if we test that range of motion, I would test my squat first, and then let's test my pigeon position. And there's a rule here. What you see a lot of yoga folks do is when they're in this position, they let their foot come back towards the hip, and then they just kind of like fall forward and they hang out and relax, and it's really not doing much of anything. It actually changes the position of your external rotators that we're trying to stretch out in relation to your femur bone. So what I want to do, guys, is remember the words parallel and perpendicular and what those mean, right? Parallel means that things are running side by side, like in a straight line. Perpendicular means they're crossing. I want my shin perpendicular to my torso, meaning that my shin's going to come down. So I would start off foot as high as is reasonable, cross it over to the other side of my body, and then I let my knee drop down. So part of the reason why I like to do this elevated is that on a smaller surface like this, I can't bring my foot closer to my hip. It's obstructed, it would fall down, and that would just be weird. So, at least if I continue doing it. Anyways, so I keep my shin perpendicular. If you're on the floor, you do the same thing. You keep your shin perpendicular. What I'll often do is use my hand on this side to really staple that down and keep it in place. It does not move. And I don't like let my hips wander forward. Is my shin perpendicular now? No. So I want to come back. And now I can much more effectively get into the corner of your hip. But your first focus, your first kind of position is just saying, how well can your knee drop off? If you can only go to like a 45-degree angle or so, that's fine. That's where you kind of move around and you're trying to get into all those little corners of your hip, of your butt, moving that about. That's all you're really trying to do when you're testing this out. See what that feels like, then go through the mobility work that we're about to do, then you come back into it, right? If you can get your knee down to the ground or to the platform, then you can start kind of hinging forward, and that's about as far as I want to go here. So I kind of feel my way through that. Okay, it's nice and tight there. So I know exactly where I'm going to be using this. So I got that right into the back corner of my bum. And so now, and you can do this on the platform, you can do it on the floor, wherever you're comfortable. This is a small surface area, but I'm going to then relax my butt as much as I can. Try to keep this leg relaxed on the floor. If I have this up, then I'm tensing my hips, and I don't want to be tensing my hips. I want to keep that relaxed. So you can use your other foot on the floor and use your hands to move your body around for you as well as you can. It'll make sense once you practice this, and you're just using that to roll yourself around. Okay? So once I've done that for 2 minutes, because I've been timing myself, that does feel really good though. Like that's a good massage. That's not uncomfortable. Even if I put some pressure in, that feels good. So I want to spend some time doing that. Make sure you breathe and relax during that. And then get back into your position, and you want to practice this position. Oh, hello. Get a little bit lower, move around in that. And then you might want to do a few rounds of that, going back and forth. And then you get into your squat, and you're trying to say, hey, is one side able to create more rotation than the other? Yes or no?
If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.